So today we will discuss hemodynamic disorders, and we will start from water transport through blood vessels. And this knowledge will help you understand mechanisms of edema. And then we will discuss mechanisms of homeostasis that normally required to stop hemorrhaging, but in pathological activation of these mechanisms, they may result in thrombosis. During our next meeting, we will continue our discussion and we will speak about embolism, about infarction, and about shock. So now let's speak about mechanisms that guide movement of the water through blood vessels. I would like to show you this beautiful picture that I'm sure every one of you already know. So this is schematic illustration of blood circulatory system with arteries, veins, and blood capillaries that are responsible for exchange of gases and nutrition between circulation and tissues. So now let's expand this fragment of blood circulation and look with higher magnification. Schematically, we can represent a microcirculatory unit as this illustration. However, it is not complete yet. So we should add here tissue. So here in such grayish color, we see a tissue that receive oxygen and nutrients from this microcirculatory unit and also remove waste products and CO2. However, even this picture is not fully complete because we are missing very important part or very important structure that plays role in water transport. We are missing lymphatic vessels. So lymphatic vessels, they also play a very important role in water transport because they responsible for drainage of the water from tissue, from extracellular spaces of the tissue. And now let's make our systemic circulation picture more complete. We see here classical illustration, but now we should add here lymphatic system. So in order to have more complete understanding of pathways of the water in the body, you see that there are lymphatic vessels that drain water from the extracellular spaces of tissue, and then this water will be transported back into systemic blood circulation. So now when you have this more complete picture, and you see here lymphatic capillaries and lymphatic vessels, let's come back to magnified picture of microcirculatory unit. And let's make it even bigger. So now we are inside of the capillary, and you see here blood, you see tissues up and down, and in green color you see lymphatic vessels inside of portions of tissues. So you see here endothelial cells, cells of the tissues. You see in green color lymphatic vessels, and of course blood. You see that from the left side we have oxygenated blood, and on the right side we have blood that goes to a vein, blood with reduced amount of oxygen and increased amount of CO2. So what forces drive transport of the water through the blood vessel? One force is blood hydrostatic pressure. This force will guide movement of the water from blood vessel inside of the tissue. Another force is osmotic power of blood proteins, and this force will guide movement of the water from the tissue inside of blood vessel. And there is another important player in this game, represented by lymphatic drainage. Some amount of water that is located in the extracellular spaces of the tissue will be transported into lymphatic vessels and then returned back into blood circulation. So, to summarize, key points that guide water transport through blood vessels, they are blood hydrostatic pressure, osmotic power of blood proteins, and lymphatic drainage. Schematically, these forces are illustrated here with white arrows. And now let's look what wrong may happen with these forces and what will be consequences of some problems. Let's imagine that blood hydrostatic pressure was considerably increased. This leads to increase in the power that drive water movement from the vessel into the tissue. And this may be one of the mechanisms of edema formation. Why this may happen? What can be a reason of increased blood hydrostatic pressure? So let's look at this schematic illustration of microcirculatory units that have arterial and venous end. And there are two obvious categories of the reasons. One reason of increased blood hydrostatic pressure is increase of arterial inflow. Another obvious reason is decrease of venous outflow. So if there will be increase of arterial inflow or decrease of venous outflow, blood pressure in this microcirculatory unit will be increased. Let's go deeper and ask question, what can be reason of these two situations? A decrease of venous outflow may happen due to impaired pumping function of the heart. So if heart is not able to perform pumping function, this may lead to a decrease of venous outflow. And this is well-known problem for people who suffer from insufficient function of the heart, that they have edema of the legs. This situation occurs due to decreased outflow of venous blood from the legs, and this leads to accumulation of blood in the legs, and due to increased hydrostatic pressure in blood vessels of the legs, will happen edema of the legs. And this is one of the symptoms that may help you to suggest problems with the heart. So if you will see similar edema on both legs of the patient, this should guide your thinking towards some problems in the heart. If you will see edema only on the one leg, this may be caused not by problems with the heart, but by venous obstruction. So if there is a problem with the heart, this problem will be systemic, and this will lead to blood accumulation in both legs. But if you see that there is a problem only with edema of one leg, most likely there is a venous obstruction in one of the legs. And also another reason of decreased venous outflow is prolonged inactivity of lower extremity, and this is also a well-known condition for everyone who was traveling during long time in the transport. For example, in airplane, when you sit for a long time, then you may feel some edema in the legs. What can be reason of increased arterial inflow? So this can be arteriolar dilatation or arterial blood pressure increase. So this is kind of overview of reasons that may lead to edema through increase of blood hydrostatic pressure. But we have another players in these games, for example, osmotic power of blood proteins. What will happen if osmotic power of blood proteins will suddenly decrease? This will lead to decrease of the power of force that guide water movement from the tissue into blood vessel. And if water movement from the tissue into blood vessel will be decreased, this will lead to accumulation of water inside of the tissue. What can be reason for this condition of decrease of osmotic power of blood proteins? Of course, decrease of concentration of these proteins in the blood. When concentration of proteins in the blood can be decreased, this may happen in case of liver dysfunction because a lot of proteins that are present in the blood produced by the liver. And if liver not able to synthesize these proteins due to not normal functioning activity of liver cells, this will lead to decrease of concentration of proteins in the blood. Another problem is dysfunction of kidneys. If due to pathology of the kidneys, those proteins that are present in the blood will be transported into the urine in high amount, in this situation, patient will lose proteins through the kidneys and they will be excreted with urine. In this pathological situation, also concentration of proteins in the blood will drop down. So even being synthesized in the normal amount, they will be lost through the kidneys if there will be dysfunction of kidneys. Another reason of decrease in concentration of blood protein is malnutrition. If food is not available for a long time, there will be no building blocks that are necessary to synthesize proteins. And this is also a reason why people who are suffering from insufficient amount of food for a long time, they may develop edema because amount of proteins in the blood will drop down. This will decrease osmotic power of protein in the blood that in normal situation should attract water from the tissue, but this attraction of the water from the tissue into blood circulation will not work normally, and water will accumulate in the tissues. And now let's focus our attention at another player in this game of water transport through blood vessels on lymphatic drainage. If lymphatic drainage will be decreased, for example, due to some obstruction in lymphatic vessel, transport of the water from tissue to lymphatic vessel will be decreased. And this also will lead to accumulation of water inside of the tissues because this water will not be drained by lymphatic system. And also I would like to draw your attention to another factor that may influence water transport through blood vessel. This factor is permeability of blood vessel wall. Let's look on schematic illustration of the blood vessel. Here you see several layers of blood vessel, and in case if permeability of blood vessel wall will be increased, this may happen during inflammation. So in case of inflammation, will be released quite a lot of cytokines that may lead to increase in permeability of blood vessels. As you see on this picture, contacts between endothelial cells are not so tight. So in this picture, there is a space between endothelial cells. And now let's look what will be consequence of such situation when there is an increase in permeability of blood vessel wall. You know that inside of so you know that in the blood there are proteins that are responsible for attraction of the, of course, they responsible for many effects, but altogether, proteins that are located inside of the blood, they create osmotic power that attract water from tissue into the vessels. And in case if permeability of blood vessel wall will be increased, some portion of these proteins that have to be located inside of the blood vessel, they will be able to go through blood vessel wall inside of the tissue. You see, increased permeability of blood vessel wall may lead to transport of blood proteins inside of the tissue. And what this means? This means that there will be a decrease in osmotic power of protein in the blood, in this microcirculatory unit. So here, locally, due to transfer of proteins from the blood into a tissue, that becomes possible due to increase of permeability of blood vessel, will be decreased osmotic power of proteins in the blood. So normal situation should be like this, but due to increased permeability of blood vessels, situation start to be like this. When certain amount of blood proteins appear to be in the tissue, and this leads to decreased osmotic power of proteins in the blood. And when osmotic power of proteins in the blood decreased, this of course will lead to decrease in water transfer from tissue into blood vessel. And this will lead to accumulation of water in the tissue. So this is one of the mechanisms of edema related to inflammation. I would say like this. Okay, and now let's go to another topic of our discussion today, that is hemostasis. Hemostasis needs for limiting and stopping of bleeding from injured vessel. So aim of hemostasis is to stop bleeding from injured vessel. And now let's speak briefly about bleeding. Bleeding results in formation of hemorrhage. So what is the hemorrhage? Hemorrhage is extravasation of blood from damaged vessels. And hemorrhage can be external or internal. Internal hemorrhage, according to volume of the blood that leaks from the blood vessel, can be divided for petechia, like very tiny amount, purpura, more amount, ecchymosis, and hematoma. So this is very brief, simplified overview of hemorrhages. They can be external or internal. Internal subdivided for petechia, purpura, ecchymosis, and hematoma. Special case is bleeding inside of the cavities in the body of patient, like hemothorax or hemarthrosis, when blood appears inside of joints, hemoarthrosis. And now let's speak about mechanisms of hemostasis that activated by injury of the vessel. So what is the sequence of event that triggered by injury of blood vessel that leads to stop of bleeding from this injured vessel? And this sequence of event starts from induction of clot formation. Then occurs propagation of clot formation that makes this blood clot bigger and more reliable, more strong. But this is only half of the story. So formation of strong blood clot is not the only job of homeostasis, because it is very important to balance these events with contra-coagulation mechanisms. That is why next step in the work of hemostasis system is limitation of clot formation. At some point, formation of blood clot have to be limited, and then have to occur resorption of blood clot. These events together represent key points of homeostasis. So homeostasis is sequence of events that composed of induction clot formation, clot propagation, then limitation of clot formation, and resorption of blood clot. When everything happens in this, I would say, workflow, this will result in repair of damaged blood vessel, and then resorption of clot will restore permeability of this blood vessel. However, in case if these two elements, limitation of clot formation and resorption of blood clot, will fail, this system may lead to thrombosis, to formation of not reasonably big blood clot that will impair blood transport through the vessel. And now let's look in more details how hemostasis working. Once again, as I just told you a few seconds before, all mechanisms of hemostasis can be triggered by, I would say in other way, not all mechanisms, but beginning of sequence of events that are related to homeostasis. This beginning is triggered by injury of blood vessel. Injury of blood vessel first will activate arteriolar vasoconstriction. And this occurs as a reflectory mechanism in response to injury of blood vessel. And also arteriolar vasoconstriction aiming to limit bleeding from the vessel. This arteriolar vasoconstriction happen also due to release of endothelium-derived vasoconstrictor factors. So there are two mechanisms. The first mechanism is neurogenic reflex. Second mechanism is that injured endothelial cells will release vasoconstrictor factors. And together, these two mechanisms will lead to constriction of injured vessel that try to limit bleeding from this vessel. Next step in hemostasis is so-called primary hemostasis that is represented by formation of platelet plaque. This happens because blood comes in contact with subendothelial von Willebrand factor and collagen. So normally, if blood vessel is healthy, this subendothelial von Willebrand factor and collagen, they are hidden from the blood by endothelial cells. So endothelial cells separate blood from what is located under endothelial cells. But in case if endothelial cells are damaged and dying, locally will be created region where endothelial cells will not cover this subendothelial space from the blood. So when endothelial cells will die, kind of a contact between the blood and subendothelial space will occur, and blood will come in contact with signaling compounds that located under endothelial cells. And such compounds, for example, von Willebrand factor and collagen. When blood becomes in contact with these compounds, this will lead to activation and aggregation of platelets. You know that platelets present inside of the blood always in normal concentration, but they are in not active state. Due to contact with von Willebrand factor and collagen, platelets becomes activated, and their activation will lead to aggregation, and this aggregation of platelets will stick to the site of damage in the blood vessel. And this is also not the end of the story, because this so-called primary platelet plug is not so strong. In order to make this plug stronger, will be performed so-called secondary hemostasis that is represented by deposition of fibrin. So you see that due to these black lines that represent fibrin, primary platelet plug becomes more strong. Why this happens? Why occurs fibrin deposition? This happens because proteins, coagulation proteins that present in the blood in not active state came in contact with tissue factor that is expressed by subendothelial cells. Once again, same concept. When endothelial cells are injured and dying, they open a window for communication between the blood, for physical contact between the blood and subendothelial space. And when blood proteins comes into a contact with tissue factor that is expressed by subendothelial space, this leads to activation of coagulation cascade. Those blood coagulation proteins that were inside of this blood vessel in not active state, they, due to contact with this tissue factor, will start to be active. And this will lead to formation of fibrin and deposition of fibrin inside of initial platelet plaque. And now let's look on this situation in more details. Let's look in more details on coagulation cascade activation. Without too much details, but we will go through key elements of this situation. Here you see a schematic representation of blood vessel, and you see that inside there are, let's say that this is quite lot. Of course, it's a few, but let's imagine that there is a quite lot of different coagulation proteins that are so far in not active state. So here you see blood coagulation proteins that are not active yet. What will happen in case of blood vessel damage? In case of blood vessel damage, blood will come in contact with tissue factor. And this tissue factor will trigger activation of this blood coagulation protein. And this will be kind of chain of reaction when one activated blood coagulation protein will lead to activation of the second, second to the third, and so on. So it will look in a very simplified way like this. Tissue factor will activate one of blood coagulation proteins, then this guy will activate second, second will activate third, third will activate fourth, and so on. And at some point, this will lead to activation of protein that is called prothrombin, and it will be transformed into active form that is called thrombin. So prothrombin is not active, but it will be activated into thrombin. And thrombin will stimulate transformation of not active fibrin again into fibrin. And fibrin will make deposition into platelet clot. And this deposition of fibrin will make this platelet clot much more stronger. Okay, if this is clear, let's go further. So far, we discussed this mechanism of clot formation in response to an injury. And now let's look briefly on another very important mechanisms that are responsible for limitation of clot formation. So limitation of clot formation is one of essential mechanisms of hemostasis. Clot formation is very important, but limitation of clot formation is also very important. So what are the mechanisms that are responsible for limitation of clot formation? Let's look at this blood vessel, and you see here formation of the plaque composed of activated platelets, and also you see here fibrin deposition. So far, it is, let's say that this is a reasonable size of this plaque, but we want to prevent further growth of this plaque. We want to prevent occlusion of blood vessel due to growth of this plaque. How we can prevent further activation of intravascular coagulation? So this job is done due to endothelial cells that are not injured. So inside of the vessel, there is a region of injured endothelial cells, but neighboring regions contain not injured endothelial cells. And those endothelial cells that are injured, they will stimulate coagulation. But those endothelial cells that are not injured, they will be responsible for limitation of coagulation activity. For example, not injured endothelial cells produce so-called tissue plasminogen activator. And this tissue plasminogen activator that is produced by not injured endothelial cells, it will activate not active plasmin and will help to transform it into active plasmin. Sorry, not active plasminogen. Plasminogen is an anticoagulation factor that is present inside of the blood in not active form. And due to activity of healthy, not injured endothelial cells, with the help of tissue plasminogen activator, plasminogen, not active, will be transformed into active plasmin. And what plasmin is doing? Plasmin is responsible for degradation of fibrin. So fibrin, as end product of coagulation cascade, can be destroyed by end product of anticoagulation cascade plasmin. And there is a kind of balance, dynamic balance between activity of coagulation cascade and anticoagulation cascade. Plasmin that is formed from plasminogen that was activated by tissue plasminogen activator, this plasmin will be responsible for degradation of fibrin, and fibrin will be degraded for not active fibrin-derived dimers. Another mechanism that prevent not reasonable increase of fibrin deposition, or in more simple word, another mechanism that is responsible for limitation of coagulation activity, also related to endothelial cells. Please look at this slide. From our previous slides, you already know that thrombin will stimulate activation of fibrinogen into active form fibrin. So fibrinogen is not active coagulative protein, and it can be transformed into active form fibrin with the help of thrombin. What endothelial cells can do with this situation? Healthy endothelial cells, they also produce a compound that is called thrombomodulin. And when thrombomodulin is associated with thrombin, this complex, thrombin plus thrombomodulin, will limit activity of thrombin. And thrombin in association with thrombomodulin will not be able to transform fibrinogen to fibrin. So now I will jump to one of our initial slides. So we discussed mechanisms that are responsible for induction of clot formation, propagation, and limitation of clot formation. That's all that we have to discuss today. And in our next meeting, I will present you second part of the lecture when we will continue our discussion further about thrombosis, about embolism, infarction, and shock.